Hi everyone, my name is Karina. I'm here with New York Sport and Spinal Physical Therapy, and today we're going to be going over what you'll expect post-op after your rotator cuff surgery. So during this experience, we want to be able to prepare you not only after the surgery, but prepare you before the surgery, what you'll expect right after the surgery, and what you'll expect during your process in physical therapy to get you back moving to how you once were. So sometimes a conservative route is great to take when you have shoulder pain, and sometimes surgery is necessary. However, a lot of things that we've seen here at the clinic is that a lot of patients don't realize what to expect after surgery. So this is a video that is going to educate you to give you the most out of your surgery and your experience so it can get you back moving properly. I'm going to be heading over to Bianca. She's going to get this video started, and thank you for watching.
Thanks for starting us off, Karina. My name is Bianca. I'm a physical therapist here at New York Sports and Spinal. I wanted to give you a few tips on how to best prepare for your rotator cuff surgery and what to expect afterwards. So when going into a rotator cuff surgery, it's important to know that all surgeons have different restrictions, different protocols for post-op rehab. So in the majority of cases, primarily all cases, your arm is going to be immobilized in a sling, usually for the first 6 weeks. So what that means for you is that you're really going to be unable to use your arm functionally like you're used to doing. So if you're someone that lives alone, or even if you do live with someone, it's important to know that you will need some assistance with functional tasks, maybe getting dressed, maybe putting on your shoes, maybe driving you to your appointments. So it's important before surgery to have those things in place and to have an idea of what to expect as far as what you're going to be able to do independently afterwards. Now, it's also important to know that rehab times can range from 4 to 6 months all the way up to 8 to 12 months. So again, that's something else to keep in mind before surgery is a little bit of a time frame of how long you might be limited in certain things that you're typically used to doing. And now that, of course, all depends on your age, your functional status, how much help you have around you, and ding, 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 how much dedication you have to physical therapy. Next segment, Karl is going to be going over what to expect when beginning PT and what the different stages of rehab entail.
Hey everyone, this is Karl at New York Sports and Spinal Physical Therapy, and today I want to talk to you about some of the most common rehab procedures after a rotator cuff repair. So first and foremost, rotator cuff repair can be very diverse. It could be a simple approach with small incision, or it could be an open incision and a longer conservative recovery process. That decision is made depending on how much damage is done and what your surgeon decides. So what I'm going to give you today is the most common post-operative procedure or rehab approach that you can expect. And in doing so, usually you're here anywhere from the day after surgery to a few weeks after surgery, but most commonly pretty soon after surgery. And you are typically inflamed, swollen, because you just went under a surgery. So you'll arrive with a sling on, and you will most likely be in that sling for approximately 6 weeks. You can expect to go see the doctor within 10 days to get your stitches out, but the sling will be on for 6 weeks. And you are allowed to take it off when you come to PT. So first and foremost, when you are in the sling, your arm is going to be in this position. And you can see that normally you would want to be moving your arm all over the place, but you are not allowed to do that. And even if you could, you won't be able to because of stiffness and pain. So if you're like this for 6 weeks, you can imagine that when you're not in this position, you are now going to be stiff. And so it's the goal of the physical therapist to be able to help you take on and off the sling and learn how to do that independently, but also when you're in physical therapy, be able to regain this motion or this motion because you're constantly in this position for 6 weeks. This can be uncomfortable, but it should never be painful as we do these activities. But everything is done passively, which means you're going to be on your back and we are going to be moving your limb in different positions because you are not allowed to yet as you recover. After roughly that 6-week mark, it's time for you to not do this on your own, but to be able to assist yourself in doing it. And one of the ways you can do that is simply with, at home, a cane or a broom. So for example, if for the first 4 to 6 weeks we're moving your arm, now you're allowed to assist it yourself. So you would be laying down and you would be moving your arm with something like a cane or a broom. All of this is being helped by your other arm, so it's not your surgical extremity doing the work. Afterwards, you then will be allowed to use your arm after the 6-week mark. And a lot of times when you're able to finally use your arm after you've regained that passive range of motion, you can't just do this anymore. You know, you're going to be compensating due to stiff or weak muscles, and you may do something like, you know, this, where your muscles compensate. So we need to break that pattern. And in order to do that, there are some soft tissue techniques that we're going to do, some joint mobility techniques that we're going to do. But otherwise, in terms of exercises, we need to improve your strength. And there's particular muscle groups that we're going to work on, but you can expect after, usually most commonly 8 weeks, we'll start using something like a TheraBand. Maybe you'll start early on pushing into a wall or a doorway where your extremity doesn't move, but eventually you'll have this motion back, and we need to get stronger in that new motion. So we'll use a TheraBand. Maybe you'll be doing some activities where you're externally rotating your arm, working on your shoulder blades, such as a row or a fly. All different things to help the stability of your shoulder blades and the strength of your rotator cuff. That way you eliminate these compensatory motions, you start moving more correctly, and that way you don't damage the new repair to help you get better and back to the function that you're aiming to improve. This whole timeline, like I said, it's 4 to 6 weeks roughly in the sling, passive range of motion, progressing towards active range of motion. By the 8 to 10 week mark, you're most commonly initiating strengthening. And as that progresses, you're expecting this to take roughly 4 months to fully recover and get back to some of the activities that you're most commonly doing in your everyday life. Thank you for watching this part of the video series, and I certainly hope it was educational. And if this is going to be helpful for you undergoing surgery or someone you know undergoing surgery, we certainly hope it was helpful and hope to see you soon.